Hi, good morning, everybody. My name is Jody Hanson. I'm the Director of Public Affairs and Communication for Johnson County. With me this morning, we have Dr. Sami Ariola, who's the Director of Johnson County Department of Health and Environment. We also have Elizabeth Holshoe, who is our Director of Epidemiology. And we have Lisa as our ASL interpreter. Thanks to all of you for being here this morning. Dr. Ariola, I thought maybe you could start by just talking to us about the plans for the clinic this week.
Thank you, Jody, and good morning, everyone. This week, clinic has been open yesterday, Tuesday, from 9 a.m. to 3 p.m. and open today also from 9 a.m. to 3 p.m. And tomorrow, Thursday, will be from 3 p.m. to 7 p.m. and on Saturday from 8:30 a.m. to noon. Overall, it is, again, the goal remains the same: to provide opportunities for people to get vaccinated if they can during work hours, 9 a.m. to 3 p.m., or after work hours, 3 p.m. to 7 p.m. Or Saturdays. So really trying to ensure that we provide opportunities no matter when you work and when you are free. And I should point out that we do have a lot of appointments, and even better still, all those hours you can actually walk in. You can walk into a clinic today, 9 to 3 p.m. You can walk in tomorrow, 3 to 7 p.m. And on Saturday, you can walk in from 8:30 a.m. to 11:30 a.m. Saturday morning. Again, providing ample opportunities for people to get vaccinated. And you can still make an appointment, which is always the easier option. But if you don't, you can walk in. Yeah.
How have things been going with the walk-in availability? Now you've been doing that for a little while now. Are you getting any feedback? Are people appreciating that flexible opportunity?
Yeah, yes, we are. So the opportunities are there. One of the things that we are emphasizing, or actually that we started emphasizing from the studies, this was not designed for everything to go through us. And so our health systems are still vaccinating, pharmacists are vaccinating, a lot of primary care physicians, independent providers are vaccinating. And so there's a lot more opportunities for walk-ins and appointments than we are currently seeing. But again, that's not surprising. We knew that after that initial vaccination of the enthusiastic 50% of our population, that will get to a place where we have to adjust that tactic. And that's why we have been working on community clinics. So we are not at capacity with people walking in. There are opportunities for people to walk in. Maybe that even changes now that we expect approval, maybe today, maybe tomorrow, for vaccinating 12 to 15-year-olds. Again, the goal remains the same: get the vaccine into the arms of as many residents as possible. And that approval was for the emergency use authorization for the Pfizer-BioNTech vaccine was made a couple of days ago by the Food and Drug Administration, FDA. ACIP, which is the Advisory Council on Immunization Practices, that makes recommendations to the CDC, the Centers for Disease Control and Prevention, are meeting today. We expect that approval, and shortly after that, we expect CDC's approval, and shortly after that, KDHE approval, and we should be ready to vaccinate. Now, when that happens, there will still be the same thing: opportunity to book an appointment, but opportunity to walk in. But also know that Children's Mercy Hospital, who has been at the center of this, are going to have vaccination events. Some of our school districts, maybe now, maybe later in the year, who are already providers, are going to have vaccination events. Others in the community are going to have vaccination events. I expect a lot more of our pediatricians to get involved. So again, the goal is now we want the resources that we are putting in to be fully utilized, but the goal is to get people vaccinated, whether it's in our clinic or somewhere else in the county.
So once vaccinations are available in your clinics for that 12 to 15-year-old age range, what are some of the rules as far as consent from a parent or guardian? Do they have to accompany that age of a person getting vaccinated? What's some of that information that parents and guardians need to know?
I'll let Elizabeth, since I've been doing all the talking, and we're all on the same page. So take that. If I need to add, I will. Go ahead.
Great, thanks. Good morning, everybody. Yeah, so for the 12 to 15-year-olds, when we get approval for that, we are asking that parents or a guardian do accompany those individuals to the clinic to be able to sign the consent form and be there. And I think that this makes a lot of sense too, as most of the time those individuals won't have the ability to have transportation on their own, right? They're going to need somebody to drive them to our clinic or to another clinic. Our 16 and up still can have a guardian or parent sign that outside of, so they can schedule an appointment, fill out all the information online and sign it ahead of time. And this is in line with also how we have been doing our testing clinics, where 16 and up are able to get tested as well. So for that younger age group, we are asking parents to come along. But if you're 16 and up and still haven't gotten your vaccine, we are offering that. I know that this week, actually, Shawnee Mission School District is doing second dose clinics for their 16 and up population. And next Saturday, Olathe School District will be doing their second dose clinic for their students that they vaccinated a couple of weeks ago.
Great.
And to be clear, which is what you meant is, it is possible, say, if a parent cannot make it for 12 to 15-year-old for another adult to be there, but with the signed consent from that parent.
Okay, that's good information to know. And can parents expect the same dose as an adult would get for their younger children, their adolescents and their teens? And I don't know if there's any difference in reactions that they can expect in a child or an adolescent or a teen versus an adult. Can you talk about that?
So the before the approval in this age range, the vaccine was tested across the country, and I really don't like getting into the dose conversation, but I would say it this time around. I think it's the same. It's the same dosage. There's no changes to that, but really, these were tested, shown to be very safe and to be very efficacious. And so, really, what we need to do is to understand that now that we've given the vaccines to millions of people, we have data unlike any that we have seen before. And even some of those that Elizabeth likes to say, very rare illnesses that we won't see if we weren't giving it to millions of people. We are finding that the risk is very, very low, definitely very low compared to that which is associated with infection with the virus that causes COVID. And so, yes, it's the same dose. It's very efficient. And we don't expect the reactions to be any different than what we have seen. Yeah.
Yeah, and just to follow up, I know that some people are concerned. It was only about a year and a half ago when we first learned about COVID-19, and now we have several very effective vaccines. I just want to reiterate that there was no rushing through the process of the clinical trials. Really, what was done with Operation Warp Speed was, instead of what normally happens, which is our pharmaceutical companies do the clinical trials in consecutive order, right? They start with step A and then they go B, C, D when it comes to the clinical trials. The federal government sort of took out some of those bureaucratic steps and allowed them to sort of overlay them. So while they started step A, they were also starting step E. And that just really sped up the timeline. It sort of condensed it. But all of the same steps that every other vaccine has gone through have been done. And we are currently under emergency use authorization. And I know that Pfizer has now submitted for full approval. And so that's also a really big step, meaning that they have that 6 month of additional data that FDA requires to go to full approval. So there was no rushing of steps. There have been no shortcuts. Every single piece that is required by the FDA and by CDC has been done. And again, you can go back and see how, there was one vaccine where they submitted data and FDA and CDC came back and said, no, this is only sort of the most recent. We want all the data. So you can see several steps along the way where those safeguards have been in place by the federal government to ensure that we are getting very safe vaccines. And again, to Dr. Ariola's point, the hundreds of millions of people who have received doses of these vaccines, it's more doses than we usually give of any vaccine. And the fact that we have so much data and have not seen really any alarming signs continues to prove that we are doing the work. The federal government is watching the data, and we can see that with J&J's pause momentarily. Deaths that sometimes happen after the vaccine are being investigated and have found no link to the vaccine itself. And so the process has been done as it should be, and is showing that we have just a very safe and effective vaccine.
And that's a great point that you just made, because we do have a comment on Facebook seeming to say that there have been maybe thousands of deaths tied to the vaccine. So is that anything you can clarify?
That is as incorrect as it can be said. It is inaccurate. We had last week a medical examiner here also speaking to this. Data is there. People do die. Unfortunately, people do die. So the issue is the contention that deaths has been linked to taking the vaccine. There's no data to support that. That's absolutely inaccurate. And I've seen some make suggestions around our region. These are data that we track. These are data that we see. And there's nothing to that. Like Elizabeth said, those are investigated. Those are continuing to be investigated, whether there's a link between death that's occurring and the vaccine, and there's no credible evidence to support that.
And the other way you can think about it, unfortunately, when we started our vaccine rollout, we were really focused on that 80 and up population. Well, unfortunately, in that age group, there are a number of individuals who die every day due to natural causes, due to other illnesses. And so when you think about when you roll out vaccine to that sheer number of people, particularly in that age group, you are going to have deaths that do happen to occur maybe in a certain time period after the vaccine that really don't have anything to do with the vaccine itself. It just happened to occur at the same time. But again, those are investigated. And, I was speaking to Dr. Peterson, and she said that there were a couple that she had looked at where that time period happened. And what she looks for is for something that's just unusual for that individual given their health history when she's conducting an autopsy. So if they had cancer, she's going to look to see if there's something else outside of that, if there was a lot of inflammation that may have been caused by the vaccine or something along those lines. And she has not seen any of those at this time. So again, no evidence that there's been any deaths linked to the vaccine, but they are being investigated when there are situations, because we do want to make sure it's safe. We do want to make sure that there isn't a link. If there is, we want to stop. And the fact of the matter is we saw that with J&J. When there was a very rare blood clotting issue, we stopped the vaccine. And so certainly if there was any indication that there were deaths associated, we would stop the vaccine rollout and hold until we got better information. And again, with J&J, it was, a handful of cases that happened, and that caused the pause. So please feel safe and reassured that the federal government, that they are watching the VAERS data, which everybody can submit. And so it is very safe.
Thank you for that information to clarify that. We have a question on Facebook. This is going back to Pfizer's announcement of their vaccine being expanded to 12 to 15. Do you know when you will offer the Pfizer vaccine for 12 to 15 here in Johnson County? So maybe just reiterate kind of what you think is the timeline, please.
Right. I expect that to happen towards the end of this week, but here are the steps, okay? So again, to be very clear, the next step is for ACIP, the Advisory Council on Immunization Practices, to make recommendations to CDC, the Centers for Disease Control and Prevention, and for the CDC eventually to give approval. And that's really the key step. In our case, though, we will want KDHE to confirm approval also, but those things happen very quickly. So if ACIP is meeting today, the expectation is that they will make a recommendation to CDC for approval. And if those happen today and KDHE approves, we could easily be giving this vaccine tomorrow or Saturday, definitely, but we'll let you know. We can't jump any of those steps, but once they're available, we'll be reaching out via media and different means, and we expect the vaccine to be available very soon.
Great, thank you. And I know you've spoken before on these Facebook Lives about your plans to start doing more and more vaccination clinics in the community. So I thought maybe you could provide us an update on those plans.
Right, I would start, and Elizabeth, please jump in. So our goal here, and it's again not entirely unexpected, is that after the initial high demand, after that's done, that our tactic will be for smaller community clinics where we're reaching out to people. And there are different groups of people. There's clearly those that have taken it, who are eager to take it. There are people that are okay with taking it, but are not going to go out of their ways to take it. Now there's the group that we need to convince to take it, who are hesitant or perhaps there's a lot of inaccurate information out there. Some of them we've tried to address in terms of efficacy and safety. And we'll continue to do that through different means. We'll answer people's questions. We have call lines that are taking people's questions. And of course, we are responding to questions on social media. Now, so those community type clinics are what we've been working on logistically. We're working with different groups. We working with religious organization churches. We have events that are being planned for a couple of days across churches to get people vaccinated. We're working with farmers market and food pantries to get vaccination done to people where there's so many creative steps that have been considered just to make it easy for people to get vaccinated. We're working with some of our higher educational institutions, Johnson County Community College, to host community events. We are meeting with the city of Overland Park this week to look for opportunities to host vaccination events. And that's just some of our team is just a group of very creative, innovative people, and they're using data to make decisions as to where we need to go when, and putting all of those together with our team that's working on the logistics. And of course, we are also looking at opportunities for businesses to indicate to us that they want to work with us to get staff and others vaccinated. So there's so many things that are being worked on. And as the need or demand for our services in the mass vaccination clinic is kind of reducing, we're shifting a lot of resources to these smaller community clinics. But if Elizabeth wants to jump in and talk through how her team is using some of this data to inform our decisions. And it's kind of interesting for me looking at the data to see the variety of activities that are going on in our county, and to look at the demographics, people that tend to attend specific events and target those. And of course, our role is to ensure that we create those opportunities for people to get vaccinated in different ways. And I expect some of them to be taken up a lot, others maybe not as much, but it won't be from my end, it will not be for lack of effort or lack of try. We are not going to get frustrated. We're going to reach out to our residents in different ways as often as we need to. Again, our goal remains the same: get our people vaccinated. Elizabeth, you want to talk more about that?
Yeah, absolutely. So if you actually want to go to our dashboard, we have a new vaccine dashboard that I believe we launched last week. If you go to jocogov.org/coronavirus and click our red button for the case and vaccine dashboard, you can click on the second tab, and it's got a lot of information about who we've been able to vaccinate so far. And one of the things that you can see on there is that as you decrease in age, we also have lower vaccination rates, which makes sense. We started with our 80 and up population and then moved to our 65 and up population. So for those age groups, we have a lot of people who are vaccinated. But certainly as you move younger and younger, and particularly into that 20 and up, 20 to 30-year-old age group, we see pretty low vaccine rates, right in the 25%, I believe. And so what we're doing is we're trying to target that group, right? I think a lot of these individuals would be willing to get the vaccine, but they're not necessarily going to seek out coming to our vaccine clinic or even maybe getting it at a pharmacy. So we want to find places where they are and go to them. So some of the conversations, and you've seen it nationally, if you're paying attention to what's going on in other communities, going to different sporting events, going to bars, going to restaurants, going to festivals, any of these opportunities where people are, and providing that as just an option as you are sort of walking through whatever that may be. The other piece that we're doing, as Dr. Ariola mentioned, is looking to partner with businesses and community organizations. And we have a form on our website. If you are a business or community organization, or you have a big event where you think that there may be people who would be interested in getting vaccinated, go onto our website, you can fill that out, and we will have one of our staff reach out to you and see whether or not it's feasible for us to send a team or even a couple of teams to come out. And so as we're sort of working on all these different options, we're looking forward to the summer and looking at some big events. There's conversations about the air show down at New Century over July 4th, potentially. We've got some Love Your Neighbor events that we're hoping to partner with religious organizations. We're looking to partner potentially with schools, and in particular, as we move into summer, where those school districts are doing food, they're giving away food for their families. We may be able to target some of those geographies, some of those zip codes, where we also haven't been able to vaccinate many people, or in certain demographic groups. We know that our Hispanic population and our Black and African American population aren't getting vaccinated at the same rate as our white, non-Hispanic, or our Asian population. So really just trying to be creative to meet people where they are and make the vaccine the easy choice as they're going about their daily lives.
Great. I think that's great that people can expect to maybe see more opportunities closer to where they live or closer to places that they're going anyway. So just to make it more convenient, I think that will get some good results for you. So it looks like we are caught up on questions. So if you wanted to go ahead and make any closing remarks, we would wrap up for this morning.
Thank you, Jody. The message to our residents remains the same, that we're not quite where we need to be in terms of vaccination. The goal for our county, for our region, state, and country will be achieved when we get the vaccine into the arms of more people. It takes us closer to where we need to be. People talk about how do we return to life like we knew it. This is our best path forward, getting people vaccinated. And we must also understand that to have this many vaccines available in a short period of time following a pandemic is a blessing. It's unusual. We have it. So we have the path, we have the solution, we have a way to get back to not having to have all of these restrictions. And I think we've shown that we're able to get there. Now, wearing masks outdoors, that's been relaxed. We are talking about vaccinated people can interact because the risk is low. We've been able to keep our childcare establishments and schools open and easier to do because we're getting the providers, the teachers, the custodians, administrators vaccinated. We are returning to providing services like we knew it. We are going to inspect establishments and having people interact more. And it's easier to do when we get more people vaccinated. So we're close. Again, out of a responsibility to yourself, but to the community, if you've not been vaccinated, please get vaccinated. We have a lot of opportunities now. You can literally walk into many, many places, to our location, to the pharmacies, to our health systems, and get vaccinated. And we'll continue to provide those opportunities moving forward. The 12 to 15-year-olds and their parents that are listening, those opportunities are coming. We expect that in a couple of days, and we'll continue to work with you to get you vaccinated. Thank you for your support for public health.
Great. Thanks so much to both of you for being with us this morning, Dr. Sami Ariola and Elizabeth Holshoe. Thank you to Lisa, our ASL interpreter. Thanks to the media who have attended today, and also those watching on Facebook and engaging on this topic. Thanks so much, everybody, and have a great rest of your day.